Good day, I'm Fiam Nora and I'll be performing phototherapy. First procedure is explain the procedure to the parents. The purpose of this is to inform the parents kung anong gagawin sa anak nila and also to reduce their anxiety. So, good day Mommy and Daddy, I'm Nurse Fiam and ako po yung mag-a-assist kay Baby A for today's phototherapy. So, ang gawin na po kay Baby ay ilalagay lang po siya sa isang mini bed, then tatapatan na po siya ng ilaw for hours. And the purpose of this is to reduce po yung paninilaw ni Baby or yung paninilaw ng skin, because too much na paninilaw po ay bad for the baby's health. And then next procedure is obtain the baseline temperature on both axilla of the infant and also check the serum bilirubin level. The purpose of this is to determine if the infant has normal temperature to undergo or to receive phototherapy. And then checking the serum bilirubin level to determine if the infant has high serum bilirubin level on the blood and also to know if the infant should receive phototherapy. So I'll now check the temperature of the infant. Okay, baby, lalagay ko lang to. Okay. So assuming that I already obtained on that side. Okay. So assuming that I already obtained the temperature on both axilla of the infant. So assuming that the temperature of the infant is within the normal range, and then upon checking the serum bilirubin level, it is above the normal range or the serum bilirubin level is high, so the infant needs to undergo phototherapy. And the next procedure is perform hand washing or hand hygiene. The purpose of this is to prevent transmission of microorganisms and also to maintain the sterility of the area. And the next procedure is apply the opaque bilateral eye patches on closed eyes. The purpose of this is to prevent possible retinal damage that may be caused by the phototherapy. So here's the eye patch. So this is only a improvised eye patch. So I'll now place the eye patch on the baby. And then next procedure is properly adjust the eye patch. The purpose of this is to prevent much pressure on the eyeballs and also to prevent circulatory impairment, reflex bradycardia, and head nodding. And then I'll now adjust. So it's already adjusted properly. And the next procedure is undress the patient or undress the infant, leaving only minimal covering on the genitals. The purpose of this is to ensure that the infant will receive balanced lighting on his or her body and also leaving on the minimal covering on the genital. The purpose of this is to maintain the to prevent possible sterility on the genitals of the infant. So I'll now undress the infant. And then I'll now cover the genital of the infant. Next procedure is open the phototherapy unit and make sure that all lights are working. The purpose of this is to promote the safety of the infant throughout the therapy. So I'll now open, so it is working properly. Next is keep the phototherapy unit as close as possible, up to 40 to 60 centimeter. The purpose of this is to ensure that the infant will receive proper and enough and also balanced phototherapy throughout his or her body, and also ensuring that the infant will maintain normal body temperature, because we all know that the light can produce heat that could make the temperature high. So, kailangan po na yung phototherapy unit is not too near to the infant and also not too far. And then next procedure is monitor the infant's body temperature every 4 hours. The purpose of this is to determine if there's an unusual findings towards the infant during the therapy, and also to maintain na nasa normal body temperature lang si infant during the phototherapy. So, assuming that I already observe and monitor the infant's temperature every 4 hours and it's still in normal or within a normal range. And the next procedure is closely monitor for side effects of the phototherapy. The purpose of this is to have an early management if there's an unusual findings towards the infant during the therapy. So, assuming that I already closely monitor the infant and there's still no unusual findings during the therapy. Next is document the procedure. The purpose of this is to have an organized data. So, kung anong ginawa kay patient. And then, observe proper body mechanics throughout the procedure to have safe and also to properly perform the procedure without any accidents. And then, observe or maintain cleanliness throughout the procedure to maintain the sterility of the working area and also to prevent contamination and infection. And then, lastly is show calmness throughout the procedure. The purpose of this is to establish rapport with the client or patient as well as with the parents. So that's all for the phototherapy.